Hello, my name's Dr. Ganguli, and Dr. Kurnew asked me to spend a couple of minutes explaining to you my food is prevention program, which he's been involved in and supported for the last few years. I work as a gastroenterologist here in Hamilton. And just as a way of introduction, what kind of got me into all of this is that several years ago, I found that I was pre-diabetic. I suddenly realized I didn't want to develop diabetes and I didn't want to end up being on drugs. So I decided to go back to the medical literature and to see if I could prevent my own diabetes from developing. So what I found was a very big study, 3,000 subjects who were pre-diabetic like me, and they randomized them to a lifestyle intervention of aggressive exercise and a healthy low-fat diet with a goal of losing 7% of body weight. They followed these subjects, and after 4 years, for every 7 people who did a lifestyle intervention, they were able to prevent one person from developing diabetes. But even more interestingly, they followed these people out for a total of 15 years. And 15 years later, surprisingly, 52% of them still developed diabetes. This was very disappointing to me because I really hoped that I would be able to prevent diabetes. So I was a bit discouraged at that point. So I went back to the literature and I kept reading. Here you can see results of a different study that I found. So in this study, they took 100 people who already had the type 2 diabetes. Half of them, they put on the American Diabetes Association diet, and half of them, they put on something called a whole food plant-based diet. So the horizontal axis is time, and they're measuring HbA1c, a very interesting blood test, which basically averages your blood sugar for the previous 6 to 8 weeks, a very accurate way of seeing how well a person's diabetes are controlled. What you can see is that within about 2 to 3 months, there was a prompt separation of these two curves, the light brown being the American Diabetes Association diet, and the black line below being the whole food plant-based or the vegan diet. Prompt separation of the lines, they stayed separated for a full 74 weeks, which is a year and a half, which is a very impressive result. Here are the results of a different study that I found later on. This is a randomized study of a small number, 48 people with documented coronary artery disease, so narrowing of the arteries on angiogram. Half of them followed the conventional care at the time, and half of them had a lifestyle intervention with meditation, relaxation, and essentially a whole food plant-based diet. They did a repeat angiogram at 1 year, and then another angiogram 5 years later to look at their blood vessels. So what you can see is they both started with about 41% narrowing. The vertical scale is percentage narrowing of the vessels. You can see that the patients in the control group, standard of care, the black dots, got more narrow 1 year later, 42%, and even more narrow 5 years later at 52% narrowing. However, the lifestyle intervention group at 1 year were less narrow than before, from 41 down to 38%, and at 5 years, it was 37%. So it went in the opposite direction. I found this very surprising indeed. So there's a photograph. I ended up adopting a whole food plant-based diet somewhat reluctantly. And there you can see the photograph of me beforehand and afterwards. I'll let you figure out which is which. After that, I learned how to build a website because I thought my patients might be interested in learning about this too. So here's my website, which you're welcome to check out. It's foodasprevention.com, and I literally walk you through the evidence for heart disease, for obesity, for diabetes. I talk about supplements, I answer frequent questions, and then I suggest concrete things you can do if you're interested in adopting a whole food plant-based diet, what to have for breakfast, lunch, and links to hundreds of recipes. So that's foodasprevention.com. But I've also started a special program to help patients who want to do this. Specifically, the research and literature has shown that the best way to adopt a plant-based diet or to make any lifestyle change is to participate in small groups. And so I see patients in consultation, and if they're interested, I allow them to join some small groups. We run currently a 6 weeks small group intervention. So we meet on Zoom on the internet. So approximately 1 hour meetings every Sunday night for 6 weeks on Zoom. So if that's something that interests you, feel free to talk to your physician about getting a referral. So I've made a special webpage for people about this program if you want to learn more about my program. So you go to my website, foodisprevention.com, and then you go /patient, PATIENT. And there you'll see a specific page which explains my program to you. But like I said, I see you briefly in consultation, occasional follow-up visits, and then you have access to these Zoom meetings. There are 6 meetings once a week for 6 weeks on a Sunday evening, roughly 1 hour. So who is this for? It's for patients who are interested in adopting a whole food plant-based diet. You need to have email and you need to know how to use Zoom. And if you're not the one who does the cooking, if your partner does the cooking, it would be lovely if at least they come to the Zoom meetings. Unfortunately, we don't have access to a dietitian. So right now, there are a few patient groups that we can't work with. Specifically, if you have kidney failure, your creatinine is over 200, if you're on a drug called Coumadin or warfarin, or if you've had bariatric surgery. But if that changes, we're happy to let people know. And these referrals are specifically for people who want help with a plant-based diet. If this interests you, like I said, feel free to discuss it with your doctor about getting a referral. Thanks very much.